Morning. Good morning. We'd like to get started. Nice to see all of you here this morning. One of the ideas that I'm emphasizing as NIJ as we move forward is the idea of translational. And I first learned about translational criminology, translational research really, from my daughter, who's a pediatrician at the University of Pennsylvania, and translational research in medicine has been embraced there full fold. In fact, they have a building for translational research in medicine. And the idea of translational criminology is a simple one, but I believe quite powerful. If we want to prevent, reduce, and manage crime, scientific discoveries must be translated into policy and practice. Now, it is no surprise, given my interest in translational criminology, that it is the theme of this year's annual conference at NIJ, Translational Criminology, Shaping Policy and Practice with Research. Now, the challenge of translating research to the field is not unique to criminology and criminal justice. Hence this plenary session, in fact, town hall panel, where we will look to other federal science agencies for help as to how to make the translation possible. And I'm very excited and pleased at the response from my colleagues in other federal science agencies who are on the stage with me here. And I'd like to introduce each in turn and tell you a little bit about how we're going to format this plenary session. Beginning with David Chambers to my immediate left. David Chambers is the Associate Director for Dissemination and Implementation Research at the National Institute of Mental Health. He leads the National Institutes of Health initiatives around the coordination of dissemination and implementation research in health. Since 2008, he has been the chief of the Services Research and Clinical Epidemiology branch at NIMH. In addition, he manages a portfolio of grants that study the integration of scientific findings and effective clinical practices in mental health within real-world practice settings. Prior to his arrival at NIMH, Dr. Chambers worked at Oxford University, where he studied national efforts to implement evidence-based practices within healthcare settings. Dr. Chambers holds a doctorate degree in philosophy. To his left is John Easton, who's the director of the Institute of Education Sciences, and just told me he's just finished up his second year in that position. Dr. Easton most recently served as the executive director of the Consortium on Chicago School Research at the University of Chicago. He holds a doctorate degree in measurement, evaluation, and statistical analysis from the University of Chicago. He's also the author or co-author of numerous reports, articles, and 2 books. Charting Chicago School Reform, Democratic Localism has a Lever for Change, and Organizing Schools for Improvement, Lessons from Chicago. To his left is Patrick Gallagher, the Undersecretary of Commerce for Standards and Technology and the Director of the National Institute of Standards and Technology, known as NIST. Prior to becoming director in 2009, Dr. Gallagher was NIST's Deputy Director and the Director of the NIST Center for Neutron Research. He served as the chair of the Interagency Working Group on Neutron and Light Source Facilities under the White House Office of Science and Technology Policy. Currently, he serves as the co-chair of OSTP Standards Subcommittee under the National Science and Technology Council. Holds a doctorate degree in physics from the University of Pittsburgh. And finally, Linda Mellgren is the senior social scientist analyst in the Office of the Assistant Secretary for Planning and Evaluation in the Department of Health and Human Services. Her areas of policy and research work include child support, fatherhood, marriage, intersection of human services, and criminal justice populations. Currently, she is manning the National Center for Family and Marriage Research on the evaluation of family strengthening grants for fathers and their partners and HHS activities related to the Interagency Reentry Council. Linda has an MPA from the Maxwell School of Citizenship and Public Affairs at Syracuse University. So what you see here is a wide range of domains of areas where research is being translated to the field of practice and policy: mental health, education, science and technology, and health and human services. So what we're going to do is I've asked each of the panelists to present 5 to 10 minutes regarding their focus on translational research. And after that, what we'd like to do is open up to the audience for questions, comments, observations, and really have a true dialogue, because I think this is a perfect way for NIJ to kick off a very serious effort at translating research to the field of policy and practice. So with that, I'm going to turn things over to David Chambers as the beginning. Thank you.